Hi everyone, my name is Krishna Dhanyamraju. I'm a second year medical student at Ohio University Heritage College of Osteopathic Medicine. I'm working under Dr. Beverly, also at Ohio University, and Dr. Ritholtz at Harvard Medical School. And today I'm presenting to you on the mediating role of social support in the relationship between depressive symptoms and self-care in adults with type 1 and type 2 diabetes. This research is supported by a grant from the American Osteopathic Association. Diabetes is one of the most significant health problems in the United States, affecting about 10.5% of the national population and 19.9% of adults in southeastern Ohio. People with diabetes experience high rates of depression, which can decrease performance of diabetes self-care and lead to higher hemoglobin A1C values. In rural southeastern Ohio, comorbid depression is especially high amongst people with diabetes, with 1 in 3 adults reporting clinically significant depressive symptoms. We believe that social support may buffer the negative effects of depression and improve clinical outcomes. The purpose of the study was to assess the moderating effect of social support in the relationship between depression and diabetes self-care in adults with type 1 and type 2 diabetes in southeastern Ohio. We conducted a cross-sectional survey study with adults with type 1 and type 2 diabetes living in rural southeastern Ohio. Data was collected using surveys distributed electronically or through mailed packets to adults with type 1 and type 2 diabetes aged 18 and over who are able to read and speak English and lived in southeastern Ohio. Participants completed the patient health questionnaire, self-care inventory, and medical outcome study social support survey. We took that data and conducted hierarchical multiple regression models, and to avoid multicollinearity with interaction terms, self-efficacy and coping styles variables were centered. What we found was that of the 325 adults that participated, the average scores for depressive symptoms, social support, and self-care behaviors did not differ by the type of diabetes. The interaction between type 1 diabetes, depressive symptoms, and social support was significant, but the interaction between type 2 diabetes, depressive symptoms, and social support was not significant. We concluded that social support had a buffering effect in the relationship between depressive symptoms and diabetes self-care in adults with type 1 diabetes but not type 2 diabetes. Social support may protect against depressive symptoms in adults with type 1 diabetes, which underscores its therapeutic value. In the future, we would like to utilize a longitudinal design to test the buffering hypothesis of social support in the relationship between depression and self-care over time. We would also like to conduct further research examining different types of social support. Thank you for listening.